Good morning, everybody. This is Daniela Caruso at the Center for the Study of Europe at Boston University. I am here to introduce a series of interviews that we are having, pairing a faculty member of Boston University with a Consul General in the city of Boston. Today, we are lucky to have with us Harriet Cross, the British Consul General. Few words about Harriet. Good morning, Harriet. I saw this remarkable woman has been a diplomat with the British for the British government, stationed in Boston for the past 4 years, and she's been with Her Majesty's government for the past 20 years, actually. Of note, a remarkable experience she had in Yemen in 2016, where she found herself as deputy ambassador at the British Embassy, caught in a conflict that required the organization of the immediate evacuation of the embassy. There are many interesting facts and stories in the life of the British General Consul today with us. The interviewer is a member of our faculty, Professor Graham Wilson of the Department of Political Science. Thank you, Graham, for being with us. Graham has a phenomenal expertise in American politics, comparative politics, and more important for today, British politics. Professor Wilson is also the director of a splendid initiative known as the Initiative on Cities, which connects academics, leaders, and politicians to make sure we have cities which have sustainable infrastructures and essential services. You can find information about it at bu.edu/IOC. Wonderful project. I am delighted to let Graham lead this interview, and thank you so much. Looking forward to this.
My pleasure. Harriet, let me start by asking you a question that used to be sort of one of those meaningless, polite questions, but today is unfortunately a real question. How are you all? How's your family? How's your staff?
We're all well, thank you. I'm here, my husband's here in Boston with me, which is really nice because he spends quite a bit of his time in the UK, but the kind of lockdown, if you like, coincided with him being here. So that's nice. I've got somebody to shelter in place with, which is good. The team is all well. The mother of one member of my team has recently passed away as a result of COVID. So it's that's the kind of the closest I've felt to the pandemic, I suppose, so far, having that happen in the last couple of weeks. But otherwise, everybody themselves is personally healthy and as well as they can be in the circumstances.
Well, please give your staff member our condolences, and we are pleased that the rest of you and your family are healthy. What difference has it made to the work of the consulate? It being the crisis, of course.
So it's made a varied amount of difference in a way. The most significant one is that we're not in the office anymore. We've all been working from home for about a month now. However, the office is still very much open, so we're still doing a full day's work. We're still, the phone lines are still open. Members of the public can still contact us. We can still issue emergency travel documents, for example. So in no sense are we closed, but we're not physically present in the office. Although the office itself is kind of physically available to us. So I go in there probably once or twice a week to check the mail, to check the facts, that sort of thing. So that's the first kind of big difference it's made. In terms of the nature of our work, we've been doing a lot more what I would call crisis work. So that's partly about assessing the needs of the British population in New England. And actually the needs of the British population are not as severe as elsewhere. So for example, we still have flights coming in and from the UK every single day from Boston, which makes a massive difference. Now I think about my colleague in San Francisco, there are currently no direct flights from San Francisco to the UK, which means that people travel plans have been disrupted. People feel, not necessarily in San Francisco because there are a lot of connecting flights, but elsewhere in the world people literally are stranded. So we don't have that sort of consular problem, if you like, in New England, but we need to prepare for it should flights from the UK to Boston cease. So we're doing some sort of preparatory horizon scanning and planning work. We've also got a team that does quite a lot of work on life sciences and healthcare, as you might imagine, being situated in Boston. That's really a team in terms of trade and investment and those sorts of links. And they're doing quite a lot of work in terms of looking at equipment. Is there a possibility to get equipment that the NHS might need in future, in particular from the US? There's work going on around the world. So our workload has shifted a little bit. Having said all that, to a certain extent, we're still doing some of the day-to-day work that we were doing. Offshore wind and clean energy being a really good example of that. We're still carrying forward some of that work.
That's great. Does this involve you working with consul generals from other countries at all, or is this very much?
It certainly involves information sharing with the other consul generals. So I've been on the phone with collectively with my European colleagues, asking them about, what do you know about flights? How are your population feeling? Are you getting into your office? So really, information sharing, getting a bit of a feel for what's going on elsewhere. There's nothing that we need to do in terms of active coordination that makes a difference to our day-to-day work. So we're not doing any formal collaboration, but we're certainly in touch with each other several times a week.
How would you characterize the similarities or differences between how the crisis is being handled in the UK on the one hand and this country on the other?
For me, I think the biggest difference is the fact that the US is such a big country. So you've got this federal and then state level response to the pandemic, which doesn't exist in the UK really to any real sense, because the UK is geographically quite a small country, and there is an element of different decisions being made in terms of the devolved areas. So Northern Ireland, Wales and Scotland are to a certain extent taking some individual decision making, but it's not really to the same extent as in the US. So there is one kind of central decision point in the UK which has said you should stay at home, only go outside for essential exercise, that sort of provision in the UK. Whereas in the US, clearly there's a much bigger disparity between what different states have decided to do. So that for me is the biggest difference. I think it's interesting, the decision that was made recently in the US about wearing masks, that the CDC advised it, and then we found the city of Boston and the state of Massachusetts not making it mandatory, but very clearly and very strongly advising people to do it, which, you know, is somewhat, I'm not going to call it controversial, but the advice on that has been mixed in the past. So the UK hasn't yet got to the stage when it's advising people to wear masks when they're outside, although I do wonder if it will get to that stage as well. So I think the interpretation of scientific evidence also varies between the UK and the US, not in any significant way, but I think that's interesting to watch as well.
Thank you. Crises can pull countries apart or bring them together. What's happened in Britain? Has it pulled people together, or has it exacerbated differences?
I think it's largely pulled people together, actually. The NHS, National Health Service, has actually always largely been something that everybody in the UK is very proud of, but there has been a difference of political opinion on the left or the right, if you want to term it that way, as to how to approach the NHS. Now, those differences haven't dissolved, but I think the paramount importance of the NHS and seeing that the delivery of healthcare, which is free on delivery, you know, we pay for it. The British people pay for it through their taxes, quite appropriately, but nobody has to worry about paying any bills if they want to get a test or if they have to be hospitalised. And I think the population of the United Kingdom have suddenly realised how absolutely incredibly valuable that is. So whereas in the States you hear stories of people worrying that they're not going to get the proper care they need because they don't have the health insurance to pay for it, that doesn't exist in the UK. So that has kind of coalesced people around the NHS, which I think is a really positive development. We've obviously, again, Brexit has been something that has divided opinion in the UK of the past years, and that's really been deprioritized quite necessarily because the government is looking at the immediate problem of tackling the pandemic. So I'm not sure that I would say that has gone away, but it's not in the topic of conversation at the moment. So again, that has reduced tensions, because that did create tensions within people's families. And the thought of being locked down and having difficult Brexit conversations, I can't even imagine. And I don't think that's happening. So that's very positive as well.
Right. I think one of my favourite sayings is that the National Health Service is the closest thing to a religion that most people in Britain have these days.
I think that's true.
I think we were all relieved that Prime Minister Boris Johnson recovered from COVID-19, and one of the things that struck me about the story was that the two nurses whom he appropriately and generously thanked were both immigrants, one from New Zealand and one from Portugal. And I wonder if this might prompt some reconsideration about the value of immigrants in British society.
I don't know, but I think it's always interesting to see how very personal experiences affect the politics and philosophy of politicians. I think it's a fascinating field, because I think the individual beliefs of politicians have massive rippling impacts on not just on countries but on the world. So yes, I think it'll be interesting to see what impact this pandemic has on politicians in the UK and around the world.
And perhaps the general public too. I did notice in the stories I read about the sad deaths of doctors and nurses in Britain who'd caught the virus from working with patients, how many of them did have names that to me indicated they'd grown up overseas. And I do wonder whether the general public will perhaps be more cognizant of the contribution of those communities.
Yes.
What about the British government working with the rest of Europe on this crisis? As you've said, Britain has officially left the European Union. We're in a transition period. Is there any cooperation still going on in this field?
Yeah, absolutely there is. I can't really talk to you about it in very much detail because it's not something that I'm involved with in my day-to-day work, and I'm much more involved with the relationships with the US government. But yeah, one thing that I noticed, even from the moment that the UK left the European Union, was that the ties, the informal ties are still very much there in terms of feeling like we are a member of Europe, even if we're not a member of the EU. And I think that's really clear. And the sort of the generosity of spirit that still exists between EU countries and the UK is still very much present. I think Germany sent some ventilators, for example, to the UK. And I notice it on a personal level here in Boston as well. So I think it's reassuring to a certain extent that those relationships continue.
Thank you. Sadly, you're about to leave us after you come to the end of your tour of duty in Boston, and you go on to be, I would assume that we can agree it's a promotion to be a High Commissioner in, is it Trinidad and Tobago?
It is, yes.
Wonderful. So a lot more sunshine than we're used to in New England. At the end of your 4 years, do you have any general reflections on Boston being Consul General for New England, etc.?
I think Boston absolutely punches above its weight in terms of sometimes how it's perceived. I think people don't know Boston as well as they should around the world. It does what it does in a very low-key way, and I think that's very interesting. When as a Consul General amongst 8 in the US, so there are 8 other UK consulates in the US, and Los Angeles and San Francisco and New York, they're the kind of the shiny kind of we're so big and impressive kind of consulates, and then Boston kind of keeps its head down. All the incredible work that goes on in the academic community, in the life sciences and healthcare community, and actually in the innovation and you know, the money that is available for people to take forward their ideas and make a huge impact in the world is, you know, second to none in Boston. And I think it's really interesting that that's not necessarily globally acknowledged. And I think to a certain extent Boston likes it that way, because it just gets on with what it's doing fairly quietly, very effectively, very efficiently, and it doesn't brag or boast, and it can do what it does without people necessarily knowing. So that for me is something that really has been brought home to me, that Boston's quite a modest place, and sometimes I feel that I have to sort of shout about it a little bit louder than maybe I would have expected to, because these incredible things like our trade and investment team that works on increasing trade between the UK and the US, they've surpassed their targets. They did the best of any consulate in the US network, because there's so much business that's done from Boston. So that what has really sort of taught me that you might be in a quiet place, but or you know, a relatively quiet place. I know Boston's a busy, fun place to be, but you know, comparatively it's quiet, but it does fantastic things, and I think that's it. Kind of, it's like one of those little secret smiles I think that Boston has, and that's what I'll take away with me, for sure. And it's just a really beautiful place as well. I tried to get out of the city a week or so ago because I stayed at home and just been walking around the common for weeks. So I went to one of the state parks, and I saw that on Twitter, one of the state government is sort of recommending that people go to some of the lesser known state parks so that they can socially isolate while they're there. And these gorgeous forests and mountains and you know, beautiful places that are just 20-30 minutes drive from Boston. I think that's it's an incredible part of the world. You can see my enthusiasm. I'm going to be really sad to leave.
Well, we're going to be sorry to lose you. We look forward to working with your successor, but I know that you will be missed in Boston and New England. Thank you so much for doing this interview.
Absolute pleasure. And I look forward to staying in touch. Maybe Boston University will have some interaction with the Caribbean at some point, and we can do this again.
We very much look forward to that. It's been a pleasure to have you with us. Thank you so much, and thank you, Graham. Have a good day, everybody. Be well. Take care.
Bye-bye.